Welcome to Conversations Live. For more than a decade, we've brought you the best in books, entertainment, celebrity interviews, and current events. When the movers and shakers of the world have something to say to you, they say it to us first. Now celebrating 17 years of broadcasting success, here's your host, Cyrus Webb.
And welcome back, everyone, to Conversations Live. I'm your host, Cyrus Webb. Glad you all could join us once again, both for our radio audience here in Mississippi at WYAD 94.1 FM, as well as those tuning in online around the world, thanks to our friends at iHeartRadio and Amazon Music Podcasts. This segment falls into our for-your health category, and it has to do with those who are living with blood cancer. For people who are battling relapsed or refractory diffuse large B-cell lymphoma, or as it's called, DLBCL, it is one of those things that they may be needing more treatment for and new options to be able to help them to live in a healthier way. Our next two guests are here to talk to us not only about what this particular blood cancer is, but also the treatment option that is available that many of you might be able to benefit from. We're excited to welcome Dr. Gordon, as well as Meghan Gutierrez of the Lymphoma Research Foundation to our program to share this information with us. Thanks to the two of you for the time. Really appreciate it.
Well, thank you, Cyrus. Thank you for having us.
Hi, Cyrus.
Hello. Dr. Gordon, we have talked on this program before about blood cancer, but talk to our audience about this particular form of blood cancer and how does this type differ from others?
So this is diffuse large B-cell lymphoma. It makes up maybe 35% of the roughly 80,000 cases a year of non-Hodgkin's lymphoma. Those 80,000 cases put it somewhere around number 7 or 8 in terms of frequency in the United States. And diffuse large B-cell lymphoma is a very aggressive, probably among the most aggressive forms of non-Hodgkin's lymphoma, but upfront initial therapy, maybe as many as 50-60% or more of patients might be cured. But the RR stands for relapsed refractory, so there are a group of patients who either don't achieve remission from their first treatment or who have a recurrence sometime later. Usually that happens within the first couple of years after initial treatment. And for those patients, the standard approach is to do bone marrow transplant, where we can still get good results in a significant number of patients. But in those patients who don't have good results with that, options become fairly limited for this aggressive form of malignancy. And because our thinking has been to try and achieve complete remissions and cure, all the new treatments that we're developing are with that goal in mind.
Dr. Gordon, I'm going to bring Meghan in here, but I want to ask you this question about the risk factors. I get questions all the time on this program about who's most at risk. What are you normally seeing about the risk factors for developing this particular form of blood cancer?
Right. Excellent question. Well, first I'll say also that my role has been as an investigator on this study and also not being compensated for my time here. But the risk factors are still being investigated. First, we know that age perhaps is one. This occurs more commonly in people between the age of 60 and 70, although we do see young people with this disease also. And we think that probably immune suppression in one form or another increases the frequency. So, for example, patients that might be on immune suppressive medications or patients who had immune suppression, say, from HIV, those were all risk factors, but we're just beginning to scratch the surface to understand the molecular abnormalities that occur. And once we understand those molecular abnormalities that happen in cells, I think we'll have a much better idea about other risk factors, perhaps environmental risk factors, dietary risk factors. There's a lot of hypotheses and guesses about this, but there's not a lot of firm data on this. But we're just beginning to study it.
Meghan, I know this is work that you are very passionate about. When I was prepping for this segment, I was watching some YouTube videos where you were doing presentations, one going back to January 2016. And so talk to us then, Meghan, if you don't mind, about the challenges for people living with this particular form of blood cancer. What are some of the challenges they face?
Well, unfortunately, as Dr. Gordon explained, diffuse large B-cell lymphoma is an aggressive or fast-growing form of the disease. And when patients relapse, they and their families often must make important decisions about their treatment very quickly. And up until recently, they've had limited options. And any new treatment option then really brings new hope to these patients and their families.
With that being said, then, Dr. Gordon, what can you tell us about these new treatment options that are available for people dealing with this aggressive cancer?
So, yes. So, Breyanzi is a form of what we call chimeric antigen receptor T-cell therapy, or CAR T-cell therapy. And it's really a departure from what has been done in the past, mainly because what's being done is that we're able to weaponize our own T cells. That's maybe the most important part, or one of the more important parts of our immune system, to weaponize our T cells specifically against this lymphoma. We kind of count on our immune system, our T cells and our B cells, to fight infection and to ward off malignancies. But when someone develops a lymphoma or any form of cancer, but certainly the blood cancers, we think there's some abnormality in our T cells that have allowed that to happen. So what's done is that T cells are collected from the patient in sort of a blood washing procedure done as an outpatient in maybe 4 or 5 hours. And those T cells are manipulated in the laboratory using a form of gene therapy to insert certain genes that make the T cells, A, recognize the lymphoma, and B, make them sort of killer T cells, if you will, as the term I used is to weaponize them. And that takes 2 to 4 weeks, and those cells are then reinfused to the patient, and really without any aggressive chemotherapy or radiation. And those T cells act like little killer T cells that attack any lymphoma cell they may see. And we've been sort of stunned at some of the responses that we've seen in patients who, up to that point, may not have quite as many options. So that's the sort of the sum of the treatment in a bit of a nutshell.
Yeah. Well, this is great information for our audience. Megan, I want to bring you back in here. I mean, because I know one of the things I noticed when it comes to Lymphoma Research Foundation is, the resources that you all are able to make available for us to know about. Where can our audience go to be able to find out more information about these types of treatments and where they can find them?
Well, Cyrus, at the Lymphoma Research Foundation, we know that a well-educated patient can be their own best advocate. Patients and their families can visit our website, which is lymphoma.org, to learn more about every type of lymphoma, including a dedicated diffuse large B-cell lymphoma learning center. We also have materials about all of the different treatment options currently available, including CAR T-cell therapy. It's a core part of our mission to bring information like this to patients, and so I wanted to mention also that we aren't compensated for our time today. Experts, including members of the Foundation's Scientific Advisory Board, like Dr. Gordon, assist us in creating the most up-to-date materials and programs for patients. And our helpline can offer support and guidance on a one-on-one basis. And these materials and resources are always offered free of charge.
Wow. Well, we definitely appreciate that. Again, everyone, Meghan Gutierrez of the Lymphoma Research Foundation, as well as Dr. Leo Gordon. Thanks to the two of you for this very important information and some hope out there for those dealing with this aggressive blood cancer. And looking forward to having the two of you back on the program again.
All right. Thank you. We'll be happy to come back. Thanks very much.
All right.
Thank you for having us today.
More than welcome. And we thank your audience for tuning in to another great segment of Conversations Live. Until next time, I'm your host, Cyrus Webb, saying as always, enjoy your day, enjoy your life, enjoy your world. Thank you all for choosing Conversations Live. Now let's go make today amazing. Take care.